Hello everyone, I'm Dr. Emily Carter, a urologist who treats both men and women. In today's video, I'm going to summarize everything you need to know about using Tadalafil, the medication widely used to treat sexual dysfunction. Tadalafil is a more modern version of Tadalafil, which is Viagra, and both are used to treat erectile dysfunction. Tadalafil is a type of drug that works by blocking a specific enzyme in the body. This increases the concentration of a substance that promotes relaxation and dilation of the blood vessels in the penile tissue. With this dilation, these tissues become more filled with blood, improving performance and facilitating an erection. Regarding how long it takes to start working, it's about 30 minutes. Its peak effect occurs about 3 hours after taking it, and the medication can last up to 17 hours. As for the forms of administration available on the market today, we have 5 mg and 20 mg tablets. Other forms can be made at compounding pharmacies like lozenges, sublingual strips, and spray. Nowadays, there are even subcutaneous testosterone implants that include the medication. It's important for the patient choosing this treatment to keep in mind that Tadalafil doesn't work by itself. Using it, just like other erectile dysfunction medications, needs to be associated with sexual stimulation. A trigger for intercourse to happen. What are the indications for using Tadalafil? Besides erectile dysfunction, we can use this medication to treat, for example, premature ejaculation. This happens when one of the causes of the problem is actually erectile dysfunction. The patient becomes insecure about the quality of his erection and ends up ejaculating faster. So in these cases, we can combine Tadalafil with another medication like paroxetine. Another indication for Tadalafil is in the treatment of symptomatic benign prostatic hyperplasia, BPH. There, we use the daily 5 mg dose, which also helps improve urinary flow. An important observation: these days there's a big focus on using this medication in gyms, aiming to improve physical performance. I'll say right now that I don't recommend this. For several reasons, I'll explain in more detail in a future video what's the right dose a patient should take. There isn't one single correct dose. The available forms on the market can be adapted to each person's needs. The right dose will be the one he responds well to, having a good erection. Some patients use a mixed scheme, combining the daily dose with a 20 mg dose as needed. Some use only the 20 mg dose when needed, and others use 5 mg every other day or even 2.5 mg. This depends a lot on the result the patient gets. The ideal is always to start with the lowest necessary dose. Regarding the choice between daily treatment or as-needed treatment, there isn't one universally correct decision. You have to consider the couple's routine and reality. What's the frequency of intercourse? How does their sex life work? To choose the best form of treatment, a very common question: does Tadalafil work for everyone? No, folks. Unfortunately, Tadalafil doesn't work for everyone. We have data showing that about 35% of patients don't respond to this type of treatment. When we look at the population with diabetes, this percentage rises to 44%. And when we talk about patients after prostate cancer surgery, this number is even higher. Only a portion of these patients will respond to the treatment. Can Tadalafil cause addiction? Patients who use it long-term are very concerned about this. Tadalafil does not cause any physical addiction in the body, but interestingly, it can cause psychological dependence. The patient can become psychologically dependent on using the medication. That's why it's very important that when starting treatment, you always have a strategy for eventually reducing or stopping the medication. This doesn't mean just stopping cold turkey. It can include switching to other types of therapy, like sexual therapy, a vacuum pump, or another method that stimulates erection. Regarding the side effects of Tadalafil, the most common are runny nose, nasal congestion, headache, body aches, and back pain. Many patients find these side effects very bothersome. But the most serious side effect is related to priapism, which is that prolonged, painful erection lasting more than 4 hours. If not treated quickly, it can lead to permanent consequences for the patient. Because of this serious risk, we cannot prescribe Tadalafil to a patient who doesn't need it, who doesn't have a real medical indication, because he runs an even greater risk of developing this condition. And finally, a very common question: can Tadalafil stop working? Yes, folks, it can. The body can become less sensitive to continued use of the medication. And this is also related to the issue of routine use. In gyms, other causes for losing the effect are the underlying condition possibly getting worse, the dose possibly needing adjustment, or psychological factors from the dependency on the drug itself. So, this is a very important and often discussed topic in our practice. If you found this video informative and think it can help you, feel free to save it, like and comment below with your questions. Take the opportunity to subscribe to the channel and turn on notifications to follow the next videos. Take care.